The purpose of this video is to teach you about chemotherapy at the Mater hospitals.
Since your diagnosis and as you commence your treatment, you may experience a range of emotions, including fear and confusion about your treatment options.
We are all here to support you by keeping you well informed. We aim to understand your questions and help you to answer them. Please feel free to write down any questions you may have and bring them with you when you come to see us.
The first question we'd like to answer is, what is cancer? Your body is made up of 1 trillion cells, healthy cells that grow and multiply in a controlled way. Once they've performed their designated function, they follow a normal process of cell death. Every day, our body makes minor errors when we replicate our cells. Ordinarily, our immune system notices these errors and gets rid of these cells and cleans up. If our immune system is unable to detect this, the cells have the opportunity to multiply. When these abnormal cells multiply, they form a tumour. Once the tumour grows and continues to grow, it can bring in a blood supply and also a lymph supply. This will further the growth of the tumour and also allow the tumour to spread to surrounding parts of the body. This is when they label your disease malignant, and they discuss metastases, which are pockets of the disease in other parts of your body and organs. Please note that not everybody has a metastatic disease, and this is something that your doctor will discuss with you.
The treatment for your cancer will depend on the type of the cancer that you have, where it started, whether or not it has spread or metastasized, along with your age and your health. There are a number of different types of cancer, so we treat them all using a variety of methods, including chemotherapy, surgery, and radiation. These treatment options can be used on their own or in a combination.
Chemotherapy. Cancer cells divide rapidly, so therefore we need to use medications that can also attack rapidly dividing cells. Chemotherapy is one of these medications. The idea of chemotherapy is to kill or slow the growth of these rapidly dividing cancer cells. Unfortunately, it does not kill just your cancer cells. It can affect other rapidly dividing cells in your body. There are many different types of chemotherapy now, and you may be given either a single chemotherapy agent or you may be given a combination of 2 or more medications. The strengths of your drugs are specific to you and calculated on your height and weight, which will be taken at the start of your treatment. At the start of each chemotherapy session, the nursing staff will weigh you to make sure that the doses that you are receiving are appropriate.
As previously said, chemotherapy can affect normal cells that grow and divide rapidly, such as those in the bone marrow where your blood cells are made, the digestive tract, the skin, and the hair. Side effects from chemotherapy can vary greatly. Some people have very few side effects, while others may experience a range. Most side effects are temporary and can be managed.
There are many different ways chemotherapy can be given. Intravenously is via a drip and travels through your body quite quickly. There is also oral chemotherapy through tablets or capsules, injections, creams, and intrathecally. Intravenous chemotherapy. This is chemotherapy administered directly into your bloodstream via a drip or an access device. This can take anywhere from a couple of minutes to several hours and will definitely depend on your protocol. Some IV chemotherapy is given over a few days via a portable device or a chemo pump, and there are many different types of IV access devices, and your medical team will select an appropriate device, which is decided upon your type of chemotherapy, how often you're going to receive it, how long your treatment will go for, and your veins. On the screen there are 3 access devices. The first is a cannula, also known as a drip. The cannula is put in by nursing staff and is left in for the duration of the treatment on that day. It is then removed and you go home with no access device left. The PICC line is our second option. It can stay in for up to a few weeks to a couple of months. The PICC line is put in by radiology under local anaesthetic. It is quite easy to remove and can stay in for the duration of your treatment. Unfortunately, this line does need to remain dry, so you'll need to wear a shower cover to shower, but unfortunately you cannot swim while this line is in. Your last option is a portacath. This is a more long-term access device. The portacath sits under your skin, as seen in the diagram, and is needing to be accessed every 6 to 8 weeks if you are not currently on treatment. The portacath is inserted in a day procedure in the surgical unit and is taken out the same way.
When you come to have treatment, you'll be reviewed by your doctor and have blood tests taken. We will ask you to complete a patient assessment form on each visit. This assessment is aimed at detecting any concerns you have before they become serious. We'll be monitoring your side effects and whether or not you may be experiencing any distress. We ask you to complete a distress thermometer, which we use to then make referrals to the cancer care coordinators or allied healthcare team. We will regularly check your temperature, blood pressure, pulse, and breathing rate. When your treatment is administered, the nurses will wear protective equipment while they're commencing, administering, changing or removing your chemotherapy. This will include a long sleeve gown, a mask, purple thick gloves, and goggles. The purpose of this equipment is to protect themselves from exposure to the chemotherapy.
We're now going to have a look at some of the side effects of chemotherapy. The first side effect we're going to discuss is feeling tired or fatigue. Fatigue is a very normal part of chemotherapy, and it may come in the form of feeling tired, feeling dizzy, feeling washed out, or wanting to sleep more than usual. During this time, it's very important to conserve your energy and only do the things that you do need to have done. It's also important to let people help you and prioritize your tasks. Light exercise can help reduce fatigue, but by no means run a marathon. You may still be able to work, but if you are currently working and you feel that you will need time off and require assistance with accessing leave or super or general financial support, please let your cancer care coordinator know. It's also important to note that daytime naps can be incredibly helpful. However, we do recommend that they stay around the 30 to 45 minute mark to preserve a good night's sleep overnight. Another common side effect of chemotherapy is nausea and vomiting and appetite change. During treatment, it's not unusual to feel nauseous or to have some changes to your taste. At this time, it's important to eat what you feel like and to maintain good oral hydration. You may need to change the way you eat and potentially change to have small, frequent meals as opposed to 3 large sit-down meals. We highly encourage you to keep taking your regular anti-nausea medications as you are prescribed and potentially switch over to more plain, dry foods. During your chemotherapy treatment, the ideal is to maintain your current weight, not to lose large amounts of weight or gain large amounts of weight. If you would like some advice requiring your dietary intake, please let your nursing or medical staff know, as we have dietitians who may be able to see you and give you further advice.
Another side effect is hair loss. Not everyone loses their hair. It depends on what drugs you are given. Your doctors and nurses will be able to advise you if the particular drugs you're having will cause hair loss. Hair can be lost from anywhere on the body, but most frequently on the scalp. It usually occurs 2 or 3 weeks after your first treatment, and in most situations will grow back after chemotherapy has been completed. It's really natural to find hair loss to be a difficult thing, but please talk to us about it. There are lots of organisations we can refer you to for advice and support. Wigs, turbans and scarves are available for purchase or loan through the Cancer Council, and there is a great program called Look Good, Feel Better, which is a support group that can help with the application of makeup and learning how to use wigs and turbans. Please ask your nurse for advice. Another common side effect can be mouth ulcers. The mouth is lined with the rapidly dividing cells we discussed earlier, so they get affected by the chemotherapy, which may lead to mouth sores or ulcers. The most important thing you can do is to keep your mouth clean using a soft toothbrush. You can also use mouthwashes 3 or 4 times a day. Homemade mouthwashes are the cheapest and easiest. A teaspoon of bicarb soda or salt in some warm water, or non-alcohol based mouthwashes such as biotin, which is available in our pharmacy. If you have mouth ulcers, avoid spicy, hot or acidic foods, and discuss any treatment or problems with your dentist.
Peripheral neuropathy is a side effect of some chemotherapy drugs affecting nerve and sensory function. Peripheral neuropathy often starts as a tingling or a numb sensation in your hands or feet. Please report any signs of this to your doctors or nursing staff as soon as possible. The bone marrow is a soft spongy material inside of our long bones, which is where our blood cells are made. The chemotherapy can disrupt the manufacture of these cells, decreasing the blood production. You'll need to have a blood test, as said before, on the day of treatment or before the day of treatment. We are monitoring your blood counts, including the red blood cells, white blood cells, and platelets.
The decreased production of red blood cells, also called anemia, can cause you to feel tired, short of breath, a bit dizzy, or have problems concentrating. You may need a blood transfusion to build up your red blood cells if these symptoms are really affecting you. Platelets are another part of the blood which help the blood to clot. A reduced number of these can cause you to bleed for longer or bruise more easily as a result of chemotherapy. Be careful using sharp objects around the home. Make sure you use soft toothbrushes to avoid irritating your gums, and present to an emergency department if you notice any blood in your urine, stools, or uncontrolled nosebleeds.
Our white cells can also be affected by chemotherapy. Our white cells are our cells that fight infection, and in particular, we're looking at your neutrophils. We will check these levels on your regular blood tests, but at home, it is really important to check your temperature regularly. We recommend that you check your temperature once a day, and also if you feel unwell at any time. If you have a temperature of 38 degrees or above, please come to your nearest emergency department if you're not local to the Mater. Otherwise, come into the Mater Emergency Department, ensuring that you have your emergency letter to ensure that you are seen quicker by medical staff. Additionally, if you have persistent or severe vomiting and can't keep any food or fluid down, unusual bleeding, a sudden increase in pain, or redness and swelling around an IV device, please also present to emergency as soon as possible. If you don't have someone at home to drive you in, please do not drive yourself into emergency. Please call 000. If you are unsure what to do, please call the Mater Cancer Care Centre during business hours Monday to Friday on 3163 5200. If you are calling out of hours and you're unsure what to do, please call the Mater Hospital switchboard on 3163 8111 and ask to be put through to the oncology ward and discuss your concerns with the nursing staff that are on overnight, unless otherwise directed by your oncologist.
To prevent getting an infection, we recommend you wash your hands regularly before eating and after going to the toilet. It's important to eat well-cooked foods to reduce any risk of food poisoning, so we don't recommend any meals from a buffet-style servery. If you have friends and family who wish to visit you, make sure that they are feeling well. They don't sneeze on you or cough on you. And during the 7 to 10 days post your chemotherapy, when your blood counts are at their lowest, we recommend avoiding heavily crowded areas.
Chemotherapy can affect your regular bowel habits. For some, you may experience some diarrhea or potentially constipation. If you're experiencing some constipation, some natural laxative options are prunes or pairs, maintaining regular exercise, and to also maintain good dietary fibre. If you are still having constipation despite using natural laxative options, there are some over-the-counter medications such as Coloxyl Senna and Movicol, but we do recommend that you talk to your medical team or nursing team prior to taking these bowel medications. If you experience diarrhea during your treatment, please stay well hydrated. Stop taking any laxative medications, and with advice from your medical or nursing team, there is an over-the-counter medication called Gastrostop that may be of assistance. During this time, please avoid spicy foods or any foods that will upset your gut.
For around 7 days after your chemotherapy, there will be traces of chemo in your blood and bodily fluids. To protect yourself and others, it's good to use good hand hygiene, such as washing your hands before you eat and after you use the toilet. After going to the toilet, close the lid before using a full flush option. If you were to soil your bed linen or clothing by vomiting, just wash them separately in a full cycle of hot water and line dry them in the sun. But otherwise you are at no risk to other people, so normal contact with friends and family is okay.
Chemotherapy may impact your desire or ability to have sex. This may be because you feel tired, unwell, less confident, or there may be a physical reason such as vaginal dryness or erectile dysfunction. You may feel concerned about having sex, however, we suggest wearing a condom when having intercourse due to the potential of chemotherapy being in your bodily fluids, such as semen and vaginal fluid. Sex may not always be possible, but closeness and sharing can still be a part of your relationships. If you want to have children in the future, please talk to your doctor about how chemotherapy may affect you and your options. Above all, keep the lines of communication open, as there may be ways that we can help you. This part of this presentation is discussing immunotherapy. If you are not receiving immunotherapy, please disregard this and the next slide. If you are receiving immunotherapy only, these are your more important slides. Immunotherapy. Immunotherapy is a new style of treatment that enhances your immune system to slow the growth and the spread of cancer cells as well as destroy them. These are referred to as monoclonal antibodies. Monoclonal antibodies attach themselves to markers on the cancer cell and are a more targeted therapy option. Because of this, they tend to impact less bodily systems, as chemotherapy does, and can have quite different side effects to chemotherapy. As previously said, the side effects of immunotherapy or monoclonal antibodies is quite different. You may experience some flu-like symptoms, fever, chills or sweats, skin rashes, nausea and vomiting, diarrhea, fatigue and headaches, wheezing, infections, weakness, and body aches. I would like to highlight some of the more serious side effects of monoclonal antibodies being flu-like symptoms, skin rashes, diarrhea, and wheezing. If you are to experience any of these, please discuss them with your medical team as soon as possible. Or alternatively, please present to the emergency department with your emergency letter that states which treatment you are receiving so you can be managed appropriately.
Many of us find it very difficult to ask for and accept support, but there are many organisations who can help. Along with us here at the Mater, there are external places who can help, like the Cancer Council or Leukemia Foundation, who have phone counselling and other practical support. Please ask your cancer nurse or cancer care coordinator to put you in touch with one of these organisations if you need more support. At Mater, we're here to support you. You are at the centre of everything we do. You'll find your doctors, cancer nurses and cancer care coordinators are able to help you, but in some situations, you may be referred to an allied health professional. These include social work for extra support, advanced care planning, financial or legal help. You may see a physiotherapy to help with any balance or mobility concerns or helping with exercise during and after chemo. You may need to see a dietitian for help with your appetite or nausea and vomiting, or a range of others including speech pathology, psychology, pastoral care, occupational therapy, palliative care, music therapy. We are all here to help you.
We'd now like to go through some common myths and get the facts to make sure we have the record straight. Can you catch cancer? No, cancer is not a contagious disease. You cannot get cancer by simply being around anybody who has it. Is cancer always fatal? No, cancer is not always fatal. We've had a lot of advances in treatment and early detection, meaning that more people are being treated successfully. Will I be vomiting all the time? No, hopefully you will not be vomiting all the time. If you are struggling with nausea and vomiting, please discuss this with your medical and nursing team and present to the emergency department if you are unable to keep food and fluid down. Will I lose my hair? Again, not always. Some patients do lose their hair depending on their chemotherapy, but if you are unsure about this, please discuss this with your nursing team. Can I use the same toilet as my family? Yes, you can. We just recommend that you close the lid and do a full flush. And lastly, can I be around pregnant ladies, newborns, and children? Yes, you can definitely be around pregnant ladies, newborns, and children. We just don't recommend that newborns or children come into the units to protect their safety and to also assist with preventing the spread of infection.
So the take-home message from this presentation is that we are here to support you. Please ask for and accept help from your family and friends. Don't hesitate to ask us any questions about your treatment or side effects.
And please continue to check your temperature regularly. Present to the emergency department if your temperature is 38 degrees or above or you're generally feeling unwell. And we do also ask that if you have seen this recording on a DVD that you return it to the nursing team. Thank you.